Hi, my name is Bailey Wood. I'm the Manager of Fundraising and Marketing at CenterPointe. I'm here today to talk with some of the CenterPointe staff about mental health and well-being, our crisis response services, and how we're creating a stronger community. Hi, I'm Bailey Wood. I'm the Manager of Fundraising and Marketing at CenterPointe, and I'm here today with our CEO, Topher Hansen. Hi, Topher.
Hi there, how are you?
I'm good, how are you?
Good.
So can you tell us a little bit about CenterPointe, a brief history, what was the need that CenterPointe responded to, and how has CenterPointe evolved to meet that need?
Certainly. It was back in 1973 that a group of people in Lincoln responded to the fact that illicit drugs were becoming an issue in the community, and that they needed to figure out a response to that to provide treatment to the people that were wrestling with these issues. And started, the name at that time actually was Lincoln Lancaster Drug Projects, and went by the name of Full Circle for a while, and ultimately evolved into the same organization, but now what is known as CenterPointe. And so the response to that field was, or to that issue, really was how we thought in the day, which was that drugs were treated in one place, and alcohol was treated in another place, and mental health in another, and primary care in another. And now we have a model that brings all of that together. But after we started the substance treatment program, then we began to realize that the people coming in the door also had mental health issues, and that we weren't, with just providing substance treatment, we really weren't resolving the mental health issue sufficient to have them be independent and really in a full program of recovery down the road. And so in the 80s, we began to evolve that way, listening to what their needs were about having mental health and substance care. And then in the late 80s, became the first in Nebraska, certainly, if not across the country, to provide integrated mental health and substance care. Beyond that, though, we recognized the fact that people were living on the streets or really in a near homeless situation, and housing was a big issue. And so in the early 90s, then we developed a housing first model that was just beginning across the country, and we adopted that to then do what Maslow talked to us about, which is to first take care of the basic needs and then begin to do some of the other things like treatment and go to self-actualization, right? So we started the housing through a HUD program that we got in 1990, and now we have probably 10 HUD contracts and a VA contract, and provide about 200 units of housing every night that's supported, that we help subsidize rent, and that we also provide a person, either a peer support person or a care manager, to work with that person to really help them get the trappings of independent living set in their life, and so they can move forward independently. So it really has evolved in terms of our listening to what their needs were and then responding to that. The last one came about a year ago, the last big one came about a year ago, when we were able to start primary care services, because we have heard about this for a long time, but it's been very difficult for us to actually provide the funding for people who don't have any money. So we served 4,269 people last fiscal year, and of those, almost 62% made less than $1,000 a year, meaning they made nothing. And so we don't have any way, until Medicaid expanded, to pay for them to have primary care services. So we got a grant, actually, that started it in August of last year, and then right on the heels of that, then Medicaid expanded, and we were able to then also bill for that. So the people that we're seeing have primary care, mental health, substance care, and we can, for those that need it, we can do housing.
Thank you. And I know you talked about this a little bit, but what makes CenterPointe unique in the field of mental well-being?
So our approach has really evolved over time, being biopsychosocial and really opening the doors up. So we want to find the thing that fits best for the person. So if it is spirituality, we want them to explore that path themselves, not the one that we think is a good idea, the one they think is a good idea. So we support them in accessing the spiritual choice of theirs. By the same token, we look at recovery as an individual process, and we want them to find the recovery support mechanism, whether it be smart recovery, dual recovery, AA, NA, their church, their friend group, whatever it is that works for them, that's what we want for them, and we'll support them in that. So the biopsychosocial gave us a very flexible, malleable structure to move forward in the world. So as science evolved and the thinking around services evolved, we were able to very easily evolve with it. The other piece really is our philosophical approach has changed, where we're really looking at the positivity of all this, not the negativity. The people that come in the door know they're sick. They know they need treatment. They know that they have some deficits in daily living and so on. What we want to focus on is their health and their well-being. So when they walk in the door, we want to point to that star for them that is health and that is well-being. The path that we're all on. I mean, I get up every day and think about, how am I going to work out today? How am I going to take care of myself? How do I have emotional well-being so the drama of the world doesn't impact me in a negative way? COVID has certainly pronounced that for everybody. So we focus on then health and well-being as our guiding star for where we want everybody to go. And we think we're all on that path. We just are in a place where we can provide professional help and services and support to help them get going on that path in a better way. And then also support the families, the loved ones of that person in a way that they can evolve as the person gets better. The whole family needs to get better and heal with all that.
I love that integrated approach in incorporating the families. Thank you.
Yeah.
I'm here with Ryan Carruthers, Vice President and Director of Clinical Operations at CenterPointe. Hi Ryan, thanks for being here.
Yeah, thanks for having me.
Ryan, can you tell us what is mental health?
So mental health is a vital aspect of our overall well-being as a person, and a lot of times we think about mental health just as it relates to diagnosable mental health conditions, and really it's a lot more than that. There's a full continuum of mental health that goes anywhere from being very happy and content with my life to having a severe and persistent, what we call SPMI, a severe and persistent mental illness. Typically what we see for most people coming in the door at CenterPointe though is that they're just kind of feeling off and struggling with depression and anxiety are the most commonly diagnosed conditions that we see at CenterPointe.
So when people are seeking help through CenterPointe, what is CenterPointe's sort of clinical approach?
Yeah, that's a great question. I think it's really something that sets us apart from others in the field and the way that we provide care. We really try to meet people where they're at. And what that means is that if someone is ready to address some of their issues and maybe not quite ready to address all of the things that are going on that they're struggling with, that we are going to work with them regardless of their hesitation to address this part of the picture or that part of the picture. That we really do try to individualize care, and then we try to wrap our care all around the person, and so treating the whole person. And so we provide their physical health care through our primary care program and have basically same-day access to our primary care provider. We have mental health providers that address the mental health needs, so those depression and anxiety needs that someone has, and we have substance use disorder care. And so if someone's alcohol use or their other substance use has gotten to the point where that might be causing problems in their life, that we're going to be able to provide that kind of whole person care to them.
So what are the signs that concerned friends or family should look for in someone who might be struggling with mental health or struggling with substance use?
Yeah, that's a question we get quite a bit. Families are like, well, I'm not quite sure, but something kind of seems off. And what we tend to tell families and loved ones and concerned others is just that if something seems off, it's probably because something's a little off. And so what we really encourage people to be on the outlook for is things are changing. The person's behavior is different than it was before. They stop showing up to things on time or stop participating in community activities or things that were important to them, work, school, church, family relationships. Suddenly those are starting to have problems in their life where before they were functioning maybe at a much healthier level. And as those things start to come up, it's probably time to reach out.
So if someone is watching this video and they're noticing those signs in themselves or someone they care about, what services are available through CenterPointe?
So like I said a little bit before, we really have a wide comprehensive list of services. We tend to group them in terms of the level of care, and so we provide residential services where people actually live in the facility as they're kind of working through their struggles. We also provide outpatient services, and the outpatient services, someone can just walk into our outpatient office and talk to either our crisis response or talk to one of our therapists that we have there that is going to be able to help identify an individualized recovery plan for that person in order to be able to help address the needs that they have. So we don't do cookie cutter plans where everybody kind of gets the same thing. What we're going to try to do is do a real thorough assessment of what is it that you've got going on, what are you struggling with, and how can we help you, you and your family, to meet those needs.
It's really great to hear if someone is struggling that there is definitely solutions and ways that they can seek help.
Yeah, we always try to let people know that there is help and there is hope out there.
Well, thank you so much for being here today.
Yeah, absolutely. Thanks.
I'm here with Amber Dirks, our Crisis Response Program Director at CenterPointe. Hi Amber, thank you for being here.
Hi, thank you for having me.
Can you tell us, what is a crisis? What does it mean to have a mental health crisis?
Yeah, so we always say crisis is really individualized to the individual. It really depends on what's going on in their life, different stressors, circumstances. So it can be from, anxiety, depression, up to suicidal thoughts, maybe, just having a bad day, facing homelessness. So it can really range on a variety of different things. We always like to tell people that crisis is really just defined by them and what they're experiencing in that moment.
And who is our crisis line for?
Our crisis line is for anybody, anywhere, at any time. So it is 24/7. Youth, families, adults, any of them can access our line. We've had people from different states access our line. And then community providers can also contact our line if they need resources, if they need crisis support within the community as well.
So what happens when you call the crisis line?
So if somebody calls the line, we're really just trying to identify what's kind of going on for them, what's causing the crisis, what's causing the stressor for them. We'll talk to them about maybe different supports that they have, different options, really try to figure out, verify safety, see if they're safe. If we have concerns about safety, we're going to really try to problem solve with them, provide coping for them, and then if we have concerns, we'll try to figure out what alternative plan that they need to come up with, whether that's going to the hospital, having somebody come check on them. But ultimately, it comes down to really just trying to figure out different supports. Sometimes it's also offering resources as far as coming into CenterPointe so that we can do some ongoing care for them as well.
Thank you. And who can benefit from calling the line?
Really anybody that's struggling. If they're having, if they're having a bad day, if they're not sure who to turn to, if they feel like they don't have a lot of supports, maybe they're hopeless, helpless, kind of feel like nothing is getting better. people that are just really needing somebody to listen to them, have a confidential conversation, feel like they're not judged. Calling our crisis line can provide that for them.
Thanks. So other than the crisis line, what are some other ways that people can seek help through CenterPointe?
Yeah, so like I said, with calling our crisis line, it's nice because we also work with a lot of community providers. So if somebody's in the community and they're trying to avoid maybe having to go to the hospital, being incarcerated, they can call our crisis line. As far as like LPD calls our crisis line, we can go out, work with the individual, again, verify safety, find some different options for them, try to hook them up with services. We also have our walk-in services at Outpatient, so people can walk in, they can meet with one of our therapists or peer support specialists to problem solve, go through what's going on, find, again, resources, get them into services. And then we also have our follow-up period, so we offer support to people for up to 30 days just to kind of, whether that's crisis wrap planning, whether that's getting into services, completing an assessment, coordinating that care for them.
It sounds like there is a lot of care options for people who are looking for help.
Yes, absolutely. There is quite a few of them.
Thank you so much.
Thank you.
I'm here with Sam Hassan, our Outpatient Operations Manager at CenterPointe. Sam, what is the Outpatient Clinic and what services are available and how does someone access them?
CenterPointe Outpatient is a certified community behavioral health clinic serving adults, youth, and families in Nebraska. Accessing our outpatient clinic is very easy. We follow same-day scheduling, so no appointments are necessary. You could just walk in, call our front desk line, and you'll get the services that you need. We have primary care services, we have medication management, peer support, crisis response. All of those services are available to the individuals that walk in.
Thank you. So when someone comes in, what is that experience like? Can you walk us through?
So it takes the intake, the admissions paperwork at the front desk. It takes about 15 minutes. Our admission staff will do a quick risk assessment, and then they'll get connected with one of our licensed counselors. They'll have a comprehensive assessment and they'll determine the appropriate level of care for the individual.
So you also mentioned a physical health services. Can you tell us a little bit about that at the outpatient clinic?
Yeah, absolutely. So we offer chronic management conditions. We offer women's health care. We have adults primary care. We offer other specialized services based on the referral. It's the same thing to access primary care services that are available to everyone in the community. To access those services, it's just, you could just walk in or you could call our front desk.
That's great. I love that you're treating the whole person. And then what happens after someone accesses services?
We have our medical care coordinators on site. We have our outreach staff. It depends on how often they need to be seen. The counselor might recommend a follow-up visit after a couple of weeks or after a month. Same thing with the provider if they're receiving psychiatric services. And we'll do a follow-up by our medical care coordinator. They're going to outreach. If they have any other services they need to access in the community, they're going to contact them and make sure they have an appointment set up to follow up with those recommendations.
Sam, can you tell us more about primary health care at CenterPointe?
Absolutely. We provide primary care, urgent care, and an array of specialized services to the individuals in the community, regardless of their financial or insurance status. Our primary care services include routine wellness exams, includes allergy management, tobacco cessation, counseling, sick visits, women's health care. We do TB testing, we do STD screening, hepatitis B, and we do help individuals with referrals to specialized care and if they need dental services through our partners in the community.
So it sounds like the services that an individual receives are really tailored to their needs.
Correct, yes. Thank you.
Yeah, that's great. Thank you so much for talking to us today.
You bet.
I'm here with Topher Hansen, the CEO of CenterPointe. Topher, what has COVID taught us about mental health and well-being?
Well, it certainly has taught everyone that they have mental health. We all have it. The question is, what condition is it in? And it's taught us about how to care for ourselves in ways we may not have ever faced before. For the vast majority of people in the U.S., I think the COVID pandemic has, and the isolation, the restricted movement and things like that have caused everybody to re-examine how they operate in the world and how they need to take care of themselves. So what I think it has taught us is that we can't take this for granted. This is an organ just like my heart and lungs and tissue and all those things are organs. And it gets sick too. And when it's under extreme circumstances, it'll get pushed to the point of some illness, really. And that's the anxiety and depression and things like that can rise out of those circumstances. So probably what it did was foster an environment that told us all that we need to be more intentional about caring for ourselves, and that if we're going to have mental well-being, emotional well-being, then what we need to do is act on that and be intentional about caring for it. So that can be where your sleep patterns are the same. You go to bed at the same time, you get up at the same time. You have a routine prior to bed. During the day, you get some exercise. You go out on a walk, and the more you can get into nature, the better. The evidence around the fact that nature gives us a lift is replete with solid data. And so knowing about how to care for yourself with exercise, the fuel that you eat, good food, the sleep that you get, not using alcohol in excessive ways or other substances to help mute some of the feeling that might be coming up. So COVID has really been accentuated the environment that we're in and the stressors that we have. And our crisis response team had exponentially greater responses in phone calls, in walk-ins, in outreach with the Lincoln Police Department, and the mentioning of anxiety and depression just skyrocketed. So we know that this pushed everybody. But just like the fact that I can sit here all day long and want my bicep to be big, but if I don't sit and do this, it's not going to be. And so in the same way, we've got to take care of our brain in the ways that it needs help to really stay balanced. And there are many things to help achieve that, but we have to do it. We have to be intentional about it.
Thank you so much. One of the things we talk about a lot at CenterPointe is how mental well-being is essential for strong communities. Can you tell us a little bit about how CenterPointe works to create a stronger community now and into the future?
You bet. So mental well-being is that place where everyone feels satisfied. You feel happy, and happy is kind of the bottom line. I'm a big happy guy. The Dalai Lama says the purpose in life is to be happy. And there is a lot of study out there on happiness and mental well-being. And so to do the thing, if everybody does that, think of your environment. If everybody in your environment is really happy, what a great environment. But think of the opposite. If everybody's sad, that's a hard environment to be in. So we all want to find things that help our individual selves, our group, and our community be happy. It's a very complex answer, but we can all take strides that way by doing things that help keep us happy. So you can read a book called Happiness Advantage. You can go sign up for online for free the course, The Science of Wellbeing by Laurie Santos. A great course that teaches you about this. You can listen to Laurie's podcast called The Happiness Lab. that she talks about these things. So all those kinds of things start teaching you about how to be happy, and then what CenterPointe is doing is providing services when people feel in crisis that we can help them start to move down the road that way. When they need treatment, we can provide treatment. So we have a large outpatient program that does mental health and substance and primary care. We have residential programs. We have over 40 services between Lincoln and Omaha to provide care to people. But more so, we're even doing things like working with elementary school kids on mindfulness. So to learn how to be mindful and to emotionally regulate when you're at a young age, and kids easily get this. I've seen 4-year-olds who really, when it's put in 4-year-old terms, really understand how to be mindful and how to regulate. So we can all work that way, and CenterPointe is here for when things don't go so well, but we're also here to help people figure out how to be well and to emotionally regulate, to be mindful, and to really take care of their emotional well-being needs. And again, our whole philosophy is on that approach, a positive approach to our mental health and our physical health, and to have our sights pointed on the positive star out in the future that is about emotional well-being and about physical health. That's a positive, strong goal for each person. So we want to participate. We want to be the place that people can look to for good information about how do I get emotional well-being, how do I help get myself healthier. We can do those things, and we can also help when things aren't so good and there's a crisis or other treatment is needed.
That's great. I love that CenterPointe is investing in the future of mental health by teaching those skills to younger kids. That's awesome.
Yeah, it's anxiety and depression are the largest illnesses in fact, in terms of what it costs society, it costs more than anything else. It is the #1 cost burden, not only in this country, in the United States and Canada, as well as countries around the world. So this is one of our giant pandemics, the illness of the brain. And the COVID pandemic pushed the brain to a point that it hadn't been before. And that's where doing things like mindfulness and emotional regulation and helping on those issues will help the entire community get well.
Well, thank you so much. Thank you for being here today.
Thanks for doing this.
Great.
Yeah.
Thank you.
Yeah.
For more information on CenterPointe and all of our services, you can reach us at centerpointe.org. To reach our same-day service line, the phone number is 402-475-5161. And if you would like to reach our crisis line, our phone number is 402-475-6695.